Pharmacokinetics. Pharmacokinetics is the study of what happens to a drug from the time it is put into the body until the parent drug and all metabolites have left the body. Pharmacokinetics represent the drug absorption into distribution and metabolism within and excretion from the body. In pharmacokinetics, there are 4 processes that you have to know: absorption, distribution, metabolism, and excretion. Let's talk about absorption. Absorption is the movement of a drug from the site of administration into the bloodstream for distribution to tissues. When it comes to absorption, we need to take in consideration the route of administration. So we have enteral routes, parenteral routes, and topical routes. Enteral routes are through the GI tract. The drug is absorbed into the system circulation through the mucosa of the stomach and or the small or large intestine. Orally administered drugs are absorbed from the intestinal lumen into the blood system and transported to the liver. Once the drug is in the liver, hepatic enzyme system metabolize it, and the remaining active ingredients are passed into the general circulation. You have to remember, sublingual is not considered enteral. Parenteral route. The parenteral route is the fastest route by which a drug can be absorbed, followed by the enteral and topical routes. Parenteral is a general term meaning any route of administration other than the GI tract, so anything outside the GI system. It most commonly refers to an injection, although there are different kinds of parenteral routes. Topical routes. Topical routes deliver medication directly to the affected area. It decreases the likelihood of systemic drug effects, and examples of this are aerosols, ointment, creams, rectal and vaginal suppositories. Bioavailability is a term used to express the extent of drug, dependent upon portion of drug that is chemically changed into active metabolites in the liver. Oftentimes, there is less bioavailable drug for enteral drugs compared to parenteral drugs. Interactions, or what can alter the absorption. So, alteration in the pharmacologic or pharmacokinetic activity of a given drug caused by the presence of one or more additional drug, and it is usually related to effects on the enzymes required for the metabolism of the involved drug. And interaction can also happen with not only with another drug but also with food as well. Distribution is the transport of the drug by the bloodstream to its site of action. Areas of rapid distribution include the heart, liver, kidney, and brain. Areas of slower distribution include the muscle, skin, and fat. Binding. If there are 2 medications that are highly protein-bound, the medications may compete for binding sites on the albumin molecule because they both compete for the binding site. There may be more unbound medications in the circulation. This may cause unpredictable levels of drugs, which leads to possible unpredictable response. Metabolism or biotransformation. It is a biochemical alteration of a drug into an inactive metabolite, a more soluble compound, or a more potent active metabolite. The primary site for metabolism is hepatic or liver. Liver is the organ most responsible for metabolism of drugs, although metabolism can also happen in the skeletal muscles, kidneys, lungs, plasma, and intestines. That being said, on your exams, if you're asked, what's the primary site for metabolism, the answer should be liver. Hepatic metabolism involves the activity of CYP450. It's an enzyme, also known as microsomal enzyme. Because of this enzyme, the drug activity can go up or down. So CYP450. In hepatic metabolism, large class of enzymes encompass the majority of meds and aids in the medication metabolism. This is one of the most important systems that influence drug-to-drug interactions. And as mentioned earlier, this can increase or decrease the drug activity. Grapefruit juice. It interacts with many drugs, either it increases or decreases metabolism. So grapefruit juice alters the drug metabolism by inhibition of the cytochrome P450 system. Some examples include amiodarone, an antidysrhythmic medication, and atorvastatin, an anti-cholesterol medication. The grapefruit juice. It decreases the metabolism of drugs used for erectile dysfunctions, estrogen, and some psychotropic drugs. On the other hand, it can increase the risk for toxicity of immunosuppressants, HMG-CoA reductase inhibitors or the statins, and some psychotherapy drugs. And one thing to remember, it also increases intensity and duration of effects of caffeine. Grapefruit juice, what it does sometimes is that when you give a medication, right, and then let's say the patient takes grapefruit juice, then an enzyme is blocked. Because of that blockage, then now there's going to be too much drug in the system or circulating in the body. On the other hand, with other medications, grapefruit juice can cause the transporter to be blocked. Therefore, there's gonna be too little drug in the body. And this is one of the reasons why it is very important to obtain a very thorough history of the patient. And you also want to know what, other than medication history, their medical history, surgical history, you also want to know about their diet, because as we know, certain food can interact with certain drugs. So if a patient states that they're drinking or eating grapefruit, then that may give you a cue to investigate even further what medications they're on, and we may need to give them some education to ensure that there's no toxicity or their drug is actually effective. First pass effect refers to the initial metabolism in the liver of a drug absorbed from the GI tract before the drug reaches system circulation through the bloodstream. Oral drugs move from stomach to portal system. So a drug that is absorbed in the intestine must first pass through and is metabolized in the liver before reaching the systemic circulation. Therefore, portion of drug change into inactive metabolites. First pass effect reduces the bioavailability of the drug to less than 100%. Many drugs administered by mouth have a bioavailability of less than 100%. On the other hand, IV drugs bypass first pass effect, right? It doesn't go through the GI system. Therefore, they often have 100% bioavailability. So, if you have a patient in the ER and he is on the following medications, let's say isosorbide mononitrate tablets, PO or by mouth, nitroglycerin or nitroglycerin sublingual, and nitroglycerin IV, the drug that will go through the first pass effect is the PO or oral route. Hence, it goes through the digestive tract. Therefore, there's a likelihood, or most likely, that drug will have less than 100% bioavailability. Excretion is the elimination of drugs from the body. So the kidneys or renal is the primary site, so primarily responsible for excretion of drugs. That being said, some drugs are also excreted through the liver and bowel. Rate of excretion or serum drug concentration, and therefore affecting duration of action. So if you have somebody with a decreased renal function, so their kidneys are not working well, there's a higher likelihood that there's an increase in serum drug concentration due to the decrease in rate of excretion. So it's taking longer for the kidneys to get rid of the medication. So there is a higher likelihood for toxicity. So again, if the kidneys are not working well, the rate of excretion will likely go down. Therefore, the drug will stay in the system longer, and there is a higher likelihood of toxicity with subsequent dosing. So when you're giving medications to your patients, you have to ensure that you also assess and evaluate how's the kidney function, right? Because that will affect how fast will they be able to get rid of the medication. So again, that's one thing to assess in addition to, of course, assessing everything else. Dosing and response. You have onset, peak, and duration. Onset is the time required for the drug to elicit therapeutic response. Peak is the time required for a drug to reach its maximum therapeutic response in the body. Duration is the length of time the drug concentration is sufficient to elicit a therapeutic response. Peak and trough levels. These are very important levels that you have to know, especially when giving certain antibiotics. So in here, this is just a diagram showing what happens during peak and trough and when does it happen, right? So this represents the drug level in the blood, right? So, and then this is time after the patient takes a drug. So what happens when the patient takes the drug? This goes up, right? So this is the peak. So what's the peak level? Peak level is the highest blood concentration level. And so if it's too high, right, you have certain levels. If it's too high, it's equivalent to toxicity. This measurement is measured by drawing blood when the drug is at the highest concentration. Now, the trough, on the other hand, goes up, right? It peaks and slowly goes down. And so right before your next dose is due, right, you have the trough. The trough level is the lowest blood concentration level. So what happens is if it's too low, we may not achieve a therapeutic response. So this is drawn immediately before the next dose of drugs, generally before the third dose, and usually we do it for a medication called vancomycin, which is an antibiotic. So this is the lowest concentration. So this is the peak and this is the trough. Half-life, you're going to hear this a lot, especially when you're giving certain medications. And so what is half-life? Half-life is the time required for 1/2 of a drug to be removed from the body. And usually, it takes about 5 half-lives for most of the drug to be considered effectively gone or removed from the body. So we need to consider half-life when we're giving medications. The shorter the half-life, then you're going to end up needing more frequent administration of the medication. On the other hand, if the half-life is longer, then the frequency is less. Loading dose, also known as bolus dose, is the larger first dose to reach therapeutic range quicker. Examples of medication that need a loading dose or a bolus dose include Coumadin, heparin, and some antibiotics. Maintenance dose or maintenance therapy is given to maintain therapeutic level. So it's given routinely. An example would be your antihypertensive medication. So it's a medication that you will take daily. Lisinopril, 20 milligrams daily. That's considered a maintenance dose because it's going to be a daily medication in order to maintain certain health status that you want to achieve. Serum drug concentration is the blood draw to assess the level of the drug to see if it's in a therapeutic range. Certain drugs will need to be evaluated for that, so therefore we would need to draw the serum drug concentration. Therapeutic range or drug level. So this is the range or level of drug concentration in the bloodstream where it is therapeutic or at the level that will produce its intended response or effect without having toxic effects. Examples of therapeutic drug levels that we monitor include digoxin, Coumadin, and lithium.